I'm never glad that the things that have happened, in that, of course, I wish that my children all had great health, and I wish that I hadn't had the health experiences that I've had. I can't help but thinking that it's helped me and my husband both be better doctors, because I think whenever you are that person in the bed or that person in the waiting room nervously wondering what the doctor is going to be like and are they going to take you seriously, and I really think that experience really expanded my knowledge, and it also helped me understand what it's like to have someone in your house be quite unwell and the impact that has on the whole family.
So who are you and why are you here?
So my name is Shauna Watts, and I'm a family doctor who lives in Australia, originally from Hollywood in Northern Ireland. I'm a 40-something mum of 4 children. I own 2 businesses. I've been a university teacher, a family doctor, and now I am a bit of an entrepreneur, I suppose, and I enjoy presenting and speaking on various women's health topics. And we're here because I decided that I've got something to say. And my job has always put me in a privileged position of being able to attend amazing conferences and hear amazing people speak who are at the top of their field. And I'm so lucky because every day I get to pick up the phone to various specialists and allied health people that I work with to get support for my patients and to get advice. And I decided that I would like to bring some of those people in to meet you all, so that you can listen in on our conversations and hopefully take a few nuggets that might help you in your life or your children or grandchildren or partner. And so that's really the thought behind the podcast.
Can you tell us about your childhood and where you grew up?
Yes, so I was born and raised in a small town just outside Belfast in Northern Ireland. And I have an older sister and lived with my mum and dad, lived a very happy, loving household. Unfortunately, my dad did pass away, but my mum is still alive and well. And everyone who knows me knows that I'm pretty obsessed with my mum. All my patients always ask me when she's coming next to visit. So she comes out quite a lot to visit, and I just love her. So that's awesome. I grew up surrounded with a big extended family. So typically Irish perhaps. My mum is one of 12 and my dad is one of 8. So there is a lot of cousins. And the lovely thing is that all those cousins were in our lives and all the aunties and uncles. So you kind of grew up with cousins who were your friends, and various cousins have come and met us, and we've met them in America. They've come to Australia. So that's really awesome. But yeah, really happy childhood. Went to school the whole way through in the same town called Hollywood, where all the stars are from. So all joking aside, it is Hollywood. And we were there before Hollywood in America, but our one is only spelt with 1 L. So, but it is pronounced Hollywood, and some pretty famous people are from there, like Van Morrison and Rory McIlroy, the golfer, and Jamie Dornan. So, we're like town of celebrities. No, it's an awesome place, and I love going back there. And after school, I went to university in Belfast. So I literally was able to take the train. And when I wasn't at university studying to be a doctor, I was working in the local supermarket and was the lottery girl, and did that the whole way until like literally about 3 weeks before I was a doctor. And I'm still in contact with lots of people that I worked there with as well. So yeah, pretty happy childhood.
When did you realize that you wanted to become a doctor?
So my dad, who I did mention, he passed away over 20 years ago, but he always tells a funny story, or always told a funny story, that he always knew I was going to be a nurse or a doctor because I always fussed and worried about him. And he was ill for a very, very long time. And he used to walk me to school each day. And apparently when I was 5 or 6 or 7 or something, I stopped dead one day on the pavement and I refused to walk. And he was like, "What are you doing?" And I apparently cried and said that his legs were too sore and that he wasn't allowed to walk me to school anymore because I was too worried that something was going to happen to him. So he would say that it was from that point. Realistically, I definitely went through a time when I was probably 12 or 13 where I was going to be a vet. And I absolutely love animals, and anyone who follows me will often see pictures of me with my Great Dane and my other dogs. So I love animals, but ultimately, I think sometime in my teens, I decided that I was going to be a doctor. And to be honest, it was just head down, bum up, and I just studied like mad to get into university. And at 18, I went off to university and started studying to be a doctor. And by the time I was 23 years old, I was on the wards as a doctor in the hospital.
And what about your own family, husband, kids?
Yes, so I met my husband, Peter, at medical school. So we did know each other right from the first few days of medical school, but we didn't start dating, I think, for another maybe 3 or 4 years. And we've been together ever since. And we have 4 children together who range from 22 to 12. And so we've got 2 boys and 2 girls. And I'm pretty obsessed with my kids, that up there with my obsession with my mother. And they're all very individual and really awesome. And I do look back and think 10 years ago when I was standing at Dublin Airport with what seemed like 27 suitcases, and I had a 2-year-old and a 4-year-old and a 10-year-old and a 12-year-old, I look back and think, God, I was so crazy. What was I thinking? Because we came to Australia and we didn't know anyone. Like, we literally did not know anyone, and we didn't know anyone on the Central Coast. But here we are 10 years later, we've got lots of friends, our kids love it, and I feel like we're so integrated. So yeah, it's been good.
And when you first started your journey as a doctor and practicing, what kind of things were you doing?
So obviously all doctors start off as hospital doctors or junior doctors, and I had a very firm idea of what I wanted to be, and I was obsessed with being a pediatric surgeon. So a children's surgeon, that was all I was going to be. No one was going to be able to talk me out of it. And lots of people did try and talk me out of it, but I was pretty determined. And I did really very well at medical school. And so I was very lucky that I actually got a position on the surgical training program, which is pretty difficult. And although I absolutely loved it and I thrived and I loved being in theatre and the operating and just the buzz, like it's definitely quite exciting, maybe just as a junior doctor, but I loved it. But what I realized quite quickly was that I actually loved talking to patients more. And I always wondered what happened next. And I realized very quickly that I loved patients' stories and I loved to be part of their stories. So one of my jobs was in the breast cancer unit, and I just remember I always used to wonder how the patients got on. Like, did that lady, did she get to go to her son's wedding? Or, did that person manage to see their son graduate? And I always wondered what happened next. And the funny thing is, I always say that general practice probably chose me a lot longer before I had made that decision. At medical school, I actually won a medal and prize for general practice. And that was quite a nice thing to win. And I was obviously really proud and really happy. But I remember being presented with the award and the professor of general practice trying to talk me into being a general practitioner. And I was quite determined, no, I'm not going to be a GP. I'm going to be a surgeon. And I look back now and think that I'm so glad that I did make that change, because I love being a doctor. I love being a GP. I'm really lucky that I'm one of those people. I look forward to every day. It's such a hard job, and I think people don't maybe appreciate actually how much you have to know about so many subjects and so many topics and so many medications. But it's actually such a privilege, and it's all the interconnections, because often know a whole family and the in-laws, and you know their story. And I definitely have quite a good memory. So people always go, I can't believe you remember that. And it's often not because I've written it down, but I'll kind of remember that really quirky comment that someone's told me about and I remember. So yeah, that's kind of was my journey to general practice. I also, throughout my career, I've always been involved really in teaching, and I taught at the university in Belfast for quite a long time. And then I've also taught students in the GP clinic. And then in later, most recent years, I've been teaching at the University of Sydney as well. And I absolutely love that. It's such a buzz. The students are so enthusiastic. And the things that I love teaching are those softer skills, like, you know, communication, but in a really soft way and looking behind what the patient is really saying. And I think that the students seem to enjoy my lessons. So I've recently had to give that up because I just don't have enough time, but it's definitely something that I've loved and I really miss. And I kind of hope in this podcast that it's something that will be able to, skills that will be transferable, because the reality is I just want to be able to help so many people and help them understand, you know, their health journey.
And of the topics that you teach or experience in your sort of day-to-day, are there any that you have sort of a deeper interest in or real focus areas for you?
Definitely. I think as a mum of 4, there's no doubt that I'm definitely still really interested in children. I love having children and teenagers in my clinic with me. I feel like I'm good at building rapport with children. But I suppose really I have gravitated a lot towards women's health and women's mental health. So I do spend a lot of time doing quite long consultations for people with complex mental health disorders. And I absolutely love the relationships that I've developed with local psychologists and psychiatrists. And, you know, I have various, eating disorder teams and things like that who work really closely with me. So I suppose those are my real interests. And then I think stemming from my own personal experiences, I also have a real interest in perimenopause and menopause. As someone who had an early menopause myself and it potentially wasn't managed the best, I think I have a lot of empathy for people who are going through that. And I think, you know, I've tried to really educate myself, because the reality is, whether we like it or not, there's not a lot of education done at medical school and in fact in a lot of training on menopause and perimenopause. And that's obviously a subject that's been getting increasing airtime, because, you know, I think lots of women have just got to the point where they've kind of had enough and they want someone to pay attention. So that was and still is a very big interest. And I suppose leading on from that, I have my own clinics now, one in the Central Coast and one in Newcastle. And that really evolved for many reasons. One, I have to admit, I was always someone who thought that I would never have anti-wrinkle injections. And so I kind of do have a chuckle to myself occasionally when I realize not only do I have them, but I give them. But I came at this because I wanted it to be different. I felt like the medicine had been taken out of aesthetics, and I felt that the medicine needed to be put back in. I felt that the doctor needed to be put back into those consultations, and I wanted everything to be slowed down. I felt like sometimes it's all become a bit of a rush, something that you maybe, you know, you're in this shopping center and you nip in and have this treatment. And I think somewhere along the way, the consequences and the potential side effects have maybe got a little bit diluted, and perhaps people don't quite understand until something goes wrong. And it was on the back of me as a GP kind of dealing with some patients who had difficult consequences of a few treatments that I hadn't done. And in fact, I didn't really know anything about at that point, that made me do a bit of a deep dive to understand what those patients had had and possibly what had gone wrong. And it made me decide that I wanted to see if I could do it differently. And so out of that was born You. So my clinics are called You by Dr Shauna Watts. And that name really was chosen for a few reasons. You, because I want my patients to know that they'll walk in looking like themselves. So you'll be you when you walk in, and you'll be you when you walk out. So I think the thing that's interesting in cosmetic medicine is there are some really incredible technologies and some really amazing research, but we've all seen this sort of skewed far end where the person who's potentially had a lot of work done, and we've seen celebrities where it's all gone a bit over the top. And I wanted to show that you actually can use some of these really interesting and great innovations, but you can use them in a very subtle way, and you can use them to improve someone's confidence, but they can walk in looking like themselves and they can walk out looking like themselves. And I think the reason that we ended up wanting to have my name in the name was I wanted to say that I'm going to take responsibility. So it wasn't that I was sort of a nameless organization, that I was going to literally sign my name below it. And that does have its own, I suppose, pressure. But that's good, because that means that I'm always striving to make sure that we always try our best. And, you know, we're not perfect. And I'm sure at times, you know, people will potentially feel like we haven't always been 100%, but, you know, I'm always striving to make sure that our customer care is amazing, that our aftercare is amazing. And in fact, you know, even there was a slip of the tongue, because they're not customers, they're patients, and we refer to them as patients. And at my clinic, we just constantly check in. The doctor's always checking in, so that you don't just go off and disappear into the ether. You know, there's always a doctor at the very minimum. Every 3 months, the doctor is bringing you back in to see how you're going. And the nice thing about our clinic as well is that I really focused our clinics on that group of women who I thought had that risk of starting to become a little bit invisible. Women who at a certain age were beginning to lose a bit of confidence, and who unfortunately in society often can become a bit ignored. And although we now attract women of all ages, I'm still really proud that for a long time our clinic was absolutely focused on that age group of sort of people between 40 and 70. And I was really happy to be working with that group of women. And what's been really lovely is just watching women who, you know, I think all of us are moving through eras of our lives. And I know I'm not the same person as I was when I was 20 or when I was 30, or in fact, even the same person that I was 6 months ago. Like, we're always evolving and growing. And, you know, I know we talk about post-traumatic stress, but I also think that there's another thing called post-traumatic growth. And I think that we all can move forward together. So I think it's a very positive clinic in a very positive environment. And that has sort of ended up, you know, what we do there has actually ended up expanding. So we've got very incorporating a lot of lifestyle medicine, helping people with their weight, helping people with perimenopause, menopausal symptoms. So yeah, the whole thing's always evolving and growing, which is fun. It's fun every day going to work.
Amazing. And what about on sort of the other side of things, your experience as not just a doctor, but being a patient yourself?
So I think that's really interesting. And although I'm never glad that the things that have happened, in that, of course, I wish that my children all had great health, and I wish that I hadn't had the health experiences that I've had. I can't help but thinking that it's helped me and my husband both be better doctors. Because I think whenever you are that person in the bed or that person in the waiting room, nervously wondering what the doctor is going to be like and are they going to take you seriously, it really helps you see how intimidating it is and how frustrating it can be. And even though we were doctors at times, you know, we have felt, you know, dismissed or not taken seriously. So I think the interesting part for us has been that of our 4 children, the first 2 were really very healthy, and we didn't really have any significant health problems. But then our 3rd child, my daughter, had very significant health problems, and I actually had to take quite a significant time out of work to spend a lot of time in hospital with her. And at that point we lived still in Northern Ireland, but we frequently had to fly to Great Ormond Street Hospital in London, where she was also a patient. And I think that probably also honed my researching skills, because my daughter's got quite a rare condition. So I would be sitting late at night researching, reading, finding journals, trying to find experts in Germany and the USA. And I really think that experience really expanded my knowledge. And it also helped me understand what it's like to have someone in your house be quite unwell and the impact that has on the whole family. We also have a child who's neurodivergent, and that's been a bit of a learning curve for us as well. I think, if I'm being honest, I probably used to pat myself on the back, probably a bit too much, about, I was such a great parent and my first 2 children were so easy. And I think, I got a bit of a rude awakening and realized that was probably more to do with their personalities rather than my and Peter's magnificent parenting. But what has been lovely is that I definitely am a believer on my good days that these children are sent to teach us something and have taught me a lot more patience and how to, work around situations and not be so shouty and things. So I think that's really helped me, both as a person and as a doctor. And then the other thing that we went through whenever I was in my early 30s, actually a few years. So my dad had passed away probably about 6 or 7 years by this time. And his sister, my dad's sister, became very unwell and ultimately died from breast and ovarian cancer. And I was very close to her. I'd grown up with her my whole life. And in fact, her end of life care, she had me front and center of it. She didn't seem to trust any other doctors than me. So I was very close to that situation. And at the same time, 2 of my cousins on that same side of the family also had breast cancer, and they were very young. And ultimately, we realized after my aunt had passed away that she carried the BRCA1 gene, which nowadays a lot of people have heard of. And because my dad had passed away, they went straight to testing myself and my sister, whereas they tested all my dad's siblings. And I have to say, I probably went into that really naively, and that was one of the situations where probably being a doctor wasn't super helpful, because I definitely didn't really think it through and think through what the potential implications of knowing would be. I was quite blasé about having the blood test. I was 100% sure it was going to be fine, and then it was a bit of a shock when it wasn't. And the way I got the news, which was actually entirely my fault. I was at work and ended up getting them. And I actually don't remember. I had to drive home that night for about 1 hour. And I actually don't even remember that journey home, because I think, there's no doubt that lots of people will see having a gene as a sort of, it's a positive thing that but bear in mind, I had literally just watched my auntie die and leave her children, and I also was watching 2 of my cousins be extremely unwell. So that was very, very hard. It was a really difficult time. I found it very scary for a long time. And I think it definitely gives you a different perspective on life. Because I feel like, you've got this thing and you have to make a decision, like, what can you do to reduce your risk? And I had certainly one plan in my mind of what was going to happen. And then I had my 3rd daughter, or my 3rd child, And when she was so unwell, all my plans went out the window because, of course, as a mum, you just focus on your child. And the reality is that I was just having regular screening tests and then got a phone call to say, actually, we need to do this surgery. So that was pretty confronting. So I think I was 32 or 33 and I had a double mastectomy or a bilateral mastectomy. And then I decided that I wanted to have another baby. So we then had our fourth child, and because of the gene that I have, it can give you breast cancer, ovarian cancer, but pancreatic, and also the gene that I have also seems to give you a type of lung cancer as well. So, there's only so many organs from your body that you can decide you're going to do something about. And there's lots of different mutations. Like some people don't have all of those risks, but those are the ones that run in our family. So basically at my cesarean section for Quinn, I went from being pregnant to menopausal in 30 minutes. So we went and we made the decision that we had to remove my ovaries. And I suppose if we fast forward now, so that's 12 years ago, that's probably one of the reasons why I have a lot of empathy for women who are perimenopausal. At that time, I was in my early 30s. Absolutely none of my friends could really understand. I couldn't really understand many of the symptoms, to be honest. It really wasn't something that was hugely talked about. And at that time, hormone replacement therapy, or HRT, had massively gone out of favor. And it was considered too risky for people who had either breast cancer or a high risk of breast cancer to be on HRT. So it was definitely quite a challenging time. And I have a look back now and think, my God, how did I survive that? But I think, I had 4 kids and it was busy and one was sick. And, so I used to just put all the symptoms down to that. But I think, again, all of those things, I'm a great believer, if it doesn't kill you, it'll make you stronger kind of thing. So I do think that it's actually helped me walk in the shoes of so many women, and not only women who are in their 40s and 50s, but also that significant cohort of women who have a very early menopause. And that might be because it's a natural thing for them, but it is also because they've had surgery or chemotherapy, or they've had to have their ovaries removed for another reason. So I think that has also really impacted the things that I'm really interested in. I had an interesting conversation with my husband this morning, and he told me that he believes that since I've known I have BRCA1, that somehow subconsciously I've decided to pack as much in as possible. So I'm always doing something, and I'm definitely one of those people who finds it hard to say no to anything. So I'm the kind of person who packs quite a lot into one day.
And all about you. Where did that name come from?
Well, as we talked about before, my other clinic is called You. So I like to always put the person at the center of everything. And really, this podcast is going to be all about you. We're going to be bringing international, Australian and local experts in their fields, authors, researchers, and we're gonna just suck all the information out of them, get all the facts so that we know what we can take into our life, because there's so many things that at the minute are in fashion, and are they fact or are they a myth? Are they worth doing? Are they actually something that has got no evidence? So what you can expect is that we're going to do a deep dive, and hopefully by the end of each episode you'll walk away with at least 1 or 2 nuggets that you can put in your pocket and take forward with you.
And what sort of topics will we be hoping to hear from you?
We're going to because it's all about you, it is literally everything that you could possibly embark upon. We're going to be talking to various researchers from Australia who are at the forefront of research in women's mental health. We're going to be talking to a bariatric surgeon about weight loss. We're going to be talking to experts about those weight loss medications that are the do's and don'ts. We're going to be talking to legal experts, relationship experts, addiction experts. We're even going to be talking to people about phone addiction, gaming addiction that may be an issue for you or your child. And you and I are going to just take a deep dive together. You get to listen in on the conversation, and I hopefully get to ask all the questions that you would want to ask if you were in my seat.
So if you had the chance and you could tell your 20-year-old self one thing, what would you say?
Gosh, one thing. I have many things I'd like to say. I think it would probably be to just be, not overthink anything, and not to worry too much about what other people think, because, with time you will evolve and grow, and, you'll find your tribe. You'll find the people who will gravitate towards you and like you for you. And even though I think that we all change, there's that core personality of who you are is probably constant. But as you mature, you probably become a little bit more relaxed and a little bit more forgiving of other people, because you realize that you're not quite perfect yourself. So I think my advice to my 20-year-old self would be, stop overthinking it. Stop worrying about what everyone else thinks of you. Just be who you are and just enjoy the ride, because it goes really quickly.
So Shauna, what's next?
We have got some amazing guests lined up, and I'm so excited to bring our next episodes to you. We're going to be dropping an episode every Monday morning to set you up for your week. You're going to be able to find the podcasts at all the usual places, Apple, Spotify, etc. You'll be able to watch the video if you want to watch us actually converse in person, and that will be on YouTube. And you can follow us on Instagram at All About You by Dr Shauna Watts as well. So I'm super excited, and I can't wait to see you all next week.